Yes, so I think interestingly, we didn't understand this at the time, but bevacizumab kind of ushered in the era of maintenance therapy, if you will. If you remember, the original design of ECOG 4599 gave carbotaxol with or without bevacizumab, but the bevacizumab was to continue until disease progression. They called it continue to disease progression. We now call that maintenance, okay? So in the case of bevacizumab, I continue the drug as a maintenance drug. I go beyond chemotherapy. I typically stop at 4 cycles of chemotherapy. ECOG 4599 allowed 6, Point Break, we stopped at 4. So whether it's 4 or 6, if the cancer is controlled, I would continue bevacizumab until you see clear evidence of disease progression. So that would be my maintenance strategy. And certainly if you're using carboplatin paclitaxel with Bev, then carbo and paclitaxel are not drugs that are easy to do for prolonged therapy, and you shouldn't, because we've proven there's no benefit to do that. So as a maintenance strategy, I would use bevacizumab alone. I think the controversy occurs when you're using pemetrexed carboplatin and bevacizumab. Both pemetrexed and Bev are drugs we use in the maintenance setting. And I think one of the areas where there's not complete clarity right now is using 2 drugs in maintenance better than 1 drug. I think there clearly is some time to progression benefit, but not clear that there's an overall survival benefit. We have a very important trial going on at ECOG, or completed its accrual, ECOG 5508, which is addressing that issue of 1 versus 2 agents in the maintenance setting with overall survival as the primary endpoint. So I think data from that, which we should know in the next year or so, will be very informative in terms of what we should do for maintenance strategy. Personally, what I do when I use pemetrexed-based doublets is I actually stop the pemetrexed and do monotherapy maintenance with bevacizumab. My rationale is bevacizumab is a first-line choice. Once you give up bevacizumab, you can't go back to it. It's not approved in the 2nd or 3rd line. Pemetrexed has a lot of versatility. It was initially approved as a 2nd-line drug, then as a 1st-line drug, and then as a maintenance drug. So you can use it in any of those settings and still fall under an FDA approval guideline. So you can always go back to pemetrexed if you stop it after 4 cycles, say.